everyone. Welcome back to Eduwisor. So today we are with Professor Archil, who is the Program Director of Emory University, Atlanta, and also the Rector of Ken Walker International University in Tbilisi. So we'll begin the video by asking Sir to introduce himself.
Hello everyone. Hello, thank you very much. Thank you for having me in India, beautiful country. Thank you to Indian people and their hospitality. I'm really enjoying it.
So to talk about Ken Walker International University, Sir, I would like you to introduce first, like what is Ken Walker International University and what kind of program, especially in medicine, is being provided to Indian students.
Happy to. Ken Walker International University was established in Georgia with the idea to establish higher education institution that would offer highest quality educational programs to anyone around the world affordably. So to make highest quality education accessible to all. So that was the idea of late Professor Ken Walker, who was a professor of medicine for over 60 years and taught thousands of the physicians and residents and students. And he worked for 30 years in Georgia, and he always thought that Georgia would be a great opportunity as a country to develop exactly that. So within the comfort of beautiful Georgia, we developed after his death Ken Walker International University to honor actually his wish and provide highest educational institution to anyone who is willing to become a physician and receive a truly up-to-date, highest standard medical education.
So when we talk about Ken Walker International University, the first thing which usually comes to the mind of students and also parents is the kind of program when we talk about USMD program. So if you can elaborate something on what is USMD program and how is it helpful for students especially who prepare for USMD.
So when we were working on the program development, we took Western medicine and Western educational model, and in this case it was American educational model. We took Emory University School of Medicine program and modified it to actually be acceptable for regulations and requirements of many different countries.
Global.
So basis is American, meaning that program is integrated. So we teach everything in correlation with all the subjects are in correlation with each other. So we don't teach them separately different things. Everything they know is connected to organ systems. Every subject is connected to each other. But also what is mainly important is program is arranged, organized the way that is answering the requirements of the United States medical licensure examination.
Yes.
As you may all have heard, USMLE, which is a necessary step if someone is planning to go to postgraduate education in the United States. But it's not only that. That for us mainly is a quality of the program, quality of education, because that is actually what dictates us how to teach the medicine correctly. And that is one of the main main lines actually highlighting, outlining the Americanization of our curriculum.
Correct. Sir, I've gone through your course curriculum, and one good thing what I've actually noticed is that Ken Walker International University focuses largely on clinical based training. Like I've gone through the curriculum and found that you focus more on OSCE. So, and not only OSCE in terms of training, but also in terms of practical examinations are also being taken. Apart from that, case-based studies are there, case presentations are there. So how exactly, if you can describe in brief that how does it help the life of a medical student, and how will it help him in the future as a doctor throughout his career?
So medicine is about clinics and hospitals, and medical education again is about clinics and hospitals. You cannot teach medicine in the classroom.
Yes, exactly.
even if that classroom is in the hospital. So medicine is taught in the hospital, in the ward, on the bedside. So to make sure that our students get the best clinical experience, we start teaching medicine from day one when they come to the school, way before they actually set foot in the hospital.
Correct.
So that happens in many different ways. But we have a course which is called Becoming a Doctor or Patient, Society and Physician. And in this course, we start students, preparing students for the clinics. And in the classroom, we have special equipment like the patient exam, clinical instruments. And in the classroom, we start students first, bedside manners, behavior, basic clinical skills, how to collect history, how to do clinical assessment.
Yes.
Then we move to simulation rooms. Then we use standardized patients, which was actually started in Georgia by us. We introduced this notion of the standardized patients. We have actually a group of highly trained and qualified artists, actors, who are trained to be patient. So they're so good that sometimes when I listen, actually I cannot separate if they are talking and having problems either real or they are making it up. So that's how we get them ready to go to hospital. Then we start them by shadowing before they start their clinical years. Once they go into the clinic, we make sure that they spend most of their time, most of their day in the clinic, in the wards.
So that not only exactly about training them to become a doctor, but also they have to take care of the environment, understand patients, because all diseases are not physiological; they are psychological as well.
Behavioral skills are important.
Very, very important.
Student needs to know, first of all, anything from professional attire.
Yes, exactly.
To like how do you stand, or what do you do when you first enter the patient room, or the guardian, like families, when you talk to them. So it's very important because that is the first impression that you create, that you enter the patient room, and how patient or the family perceives you as a professional or not, because all our students are introduced to the patients and patient families and as a student doctor. So we require from them some professional skills, professional attire when they are in the clinic. Also, of course, in the classroom they can be in free, comfortable clothes, but like when they go into the clinics, we require our students to have a professional attire because they are professionals there.
So moving on to our next question. Sir, we would like to know from you that how many hospitals are affiliated with Ken Walker International University, and how are internships provided to students with these affiliated hospitals?
That's a good question. We always say that medical education cannot be provided without clinics, hospitals, affiliations. So medical education, medicine is taught at bedside, not in the classroom. So yes, there is a certain number of work that is done in the classroom, preparation for the clinics, especially the preclinical, pre-med education. But when they move, after the 3 years, when they move to the clinical education, students must be spending most of their time in the clinics. So that's what separates our program in general Western medical education from many other programs around the world, so that student actually learns at bedside. We have affiliations with many major hospitals in Georgia. In fact, we ourselves built in Georgia Ken Walker Rehabilitation Clinic, which is located on the same campus where Ken Walker International University is. In fact, many classes are conducted, and in the same hospital campus we are building now a new academic building too. In addition to that, we have a direct affiliation with the largest hospital, high technology, Ingorovo Highland Technology University Clinic in Georgia, and we have the Chapidze Heart Center affiliation, pediatric affiliation. So we make sure that every collaboration with the hospitals we have, it's a strong affiliation. It's not just some kind of MOU. We actually work. And right now very soon we will have some more news where we are working with the individual hospitals who will actually provide services just for the Ken Walker International University students. Most importantly that I need to mention, our students have a unique opportunity to actually, as part of their education, take the clinical trainings as part of their internship, as it's often called here in Georgia. Actually, what we call in US, we call it clinical electives, rotations, so to call clerkships, elective clerkships, right? Our students have this unique opportunity actually to do part of their clinical education at Emory University. So those students who pass USMLE Step 1, which is required in US to be able to work with the patient, actually have a guaranteed place, because we at Emory have an official agreement and collaboration with Ken Walker International University. They have a guaranteed space, and also that space, that education is free of charge for the students. It's part of their general education. Or the only expense they may have is gonna be the travel expenses. But this tuition that usually students pay for as a visiting student to US medical schools in the clinics, it's waived for them, because this is part of their tuition and it's part of the agreement. So our students will get very strong clinical exposure, patient exposure, and clinical education.
So to speak of, most of the students who actually want to get into a USMD program probably have their goals to probably settle in the US. So how does this clinical training of probably what you mentioned as at Emory, so how will it help them in their residency matching? So does this play a very important role?
It plays a very important role, because if you are a program director and you are taking someone in, you certainly want to look whether or not the student or the applicant or graduate has an experience in a setting where you are taking them in. And when you see a student who has worked in US settings for 1 month, 2 months, 3 months, certainly you are more confident that, the students will do well, because in the residents will do well. Because in postgraduate medical education, after the medical school, what residents do is they work very hard and they take care of the patients. And as a program director, you want to make sure that whoever you hire, recruit as a resident is actually capable of taking care of the patients in this new setting. So that's the unique opportunity you get at Ken Walker International University. In addition to that, there are many other things you need to match in the clinical residency in United States. You need the recommendation letters, which you will get from the attending physicians that you work with in United States when you get your training, right? In addition, you need to understand what you expect, how to write a motivation letter, what to expect and how to behave during the interview, even where to apply, because there are thousands of residency programs, and not every residency program may be for everyone. Yeah. Because you need to know with your background what is your best chance. So for all of that, we provide this career coaching. Our colleagues both from Emory and Georgia will work individually with the students and help them figure out, first of all, learn how you write your motivation letter. Then how do you behave and what to expect during the interview. And third is, when you are applying, do you have a better chance to go in a university A, or in the residency program A or residency program B, so that there are a lot of things. There's a travel cost, there is a application cost, and there is some psychological value associated with it. So you need to make sure that you apply to those that best, that your background best meets the requirements. So our university also provides all the career coaching and the training for the students.
So, since NLC already announced that next examination, and Ken Walker has that American course, so if you can tell me like how this American course will help Indian students in next examination?
That's a very good question. You know, I only recently learned about the next exam, and from what we are still reviewing it, but from what we already learned and what we know, we are very excited because it's very similar to the USMLE requirements. So we are happy to say that, you know, basically American MD program is organized the way that it prepares the students for next exam because it's built already that way, because there's a lot of similarities. Again, as I said, we are still studying in details all the requirements, but from the review we had in the last week that we learned about the next exam and discussed with our colleagues, there are more similarities than not between the USMLE requirements and next requirements, and we are excited to announce that, you know, our program meets 100% all of those requirements. So again, the only thing that student needs to do is come and study hard, because everything else program provides them guidance, educational model, quality of education, environment. So everything is there. The only thing students need to do is study hard, and that we can do for them. So other than that, you know, that's something they will do very well. One thing I want to mention, you also mentioned that most students probably want to go to US. That's fine. As I said, you know, it doesn't matter. If they want to go to US, they will be prepared for that. If they want to come to India, they will be prepared for that. Our goal is for students to graduate and be successful wherever they want to go and practice. For us, it doesn't matter where they go. For us, what matters is if you graduate from our program and want to go to US, be successful there, and if you want to come back to India, be successful in India. That's what matters for us. So we will equip you with all of that. How you use it, it's totally up to you, because it's your knowledge, you own it, and you actually have to decide your future where you want to build it.
Yeah.
Moving on to our last question for today, and that is, sir, that how has your experience been till now of handling Indian students, especially Indian students, and what message would you like to give to prospective Indian students who would like to come and study at Ken Walker International University?
Again, first of all, in general, I think Indian people are one of the warmest and nicest people I've ever met. And I'm so grateful I got connected with this nation. I love my time here, coming here. Your hospitality is just wonderful. This country is beautiful. And Indian students have great potential. They are one of the fast learners, best learners, and some of the nicest young human beings I've ever met. And I've interacted with a lot of students. Usually they are all very nice, they are very good. So I want to separate. I love Indian nation. I love interacting with Indian students, talking about different things. One thing I want to repeat, going to medicine requires a lot of hard work. It requires a routine. It requires a discipline. So if you get that thing worked in the first days, and we are there to help you, work with you. So our doors are always open. We are most accessible people you can find. So you will never find our doors shut, locked. You will never have to wait for long appointments. Most of the times you can just come and knock at any of our doors and we'll be able to see you almost immediately, unless we have someone in the room already. And so we are accessible. What we want from you is just make sure that you approach us if you have any challenge, because you won't have problems. there will be challenges. Medical education and higher education is challenging. It requires a lot of hard work, especially medicine. But, you are the brightest minds, especially in the age you are right now, and make sure that you use that for your advantage. So if you show up in class on time, if you do your homework on a daily basis, there is no way you are going to have any problem. Didn't understand anything? Come and talk to us. You'll have small group advisors. You have your own professors. So talk to them. Don't postpone. Don't put it in a drawer. Don't accumulate those challenges, because it's going to be harder to break 10 things than break one thing. So breaking in a good sense, breaking a challenge. But anyway, I wish you all good luck. Your students good luck. You are in very good hand, because this is best agency that we are working with you, your agency, with company that takes care of their students. They do everything perfectly, from handling the documents to taking care of the students in the country. And we wish you good luck. You are in a very good hands, both from the consulting agency side to the education side. So all you need to do is study hard. Everything else is taken care of between us and your parents.
So before we end this video, one message which I would like to give to all students and parents is that Ken Walker International University gives you a wonderful chance to pursue USMD program from Georgia at a very nominal cost. And like sir mentioned, that it also, add-on feature which you get, and which is very important, is that you also get a chance to, probably pursue clinical rotations from Emory School of Medicine, which is in the United States, and that will probably help you in your future residency matching. So with this, we end the video. Hope to see you soon in the next. Stay tuned.